Good afternoon. Thank you for joining us for today's webinar. My name is Natalie Ortiz, and I am a program manager at the National Association of Counties. I will be filling in today for Nastasia Walsh and moderating the webinar. This webinar is a part of Stepping Up, a national initiative to reduce the number of people with mental illnesses in jails, and is a result of a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation, with generous support from the U.S. Department of Justice's Bureau of Justice Assistance and other private sponsors. Before we begin, I'll go over a few technical details to ensure everyone can view the webinar correctly. This webinar is being recorded and it will be posted on the Stepping Up website for future viewing. You will receive an email tomorrow with the link to the webinar recording. Also, to the right of your screen, you will notice there is a control panel, and in this panel, there is a questions box. You can use this box to type in questions or at any time to send us a message if you are experiencing technical difficulties. If you are having any technical problems, we will respond to you privately to help resolve the issue. During the Q&A session, after all of the panelists are done speaking, I will read the questions on your behalf. Should you wish to have a better view of the presentation, you can click on the small orange arrow in the top left corner. As part of the Stepping Up launch, the partners asked counties to join the initiative by passing a resolution or proclamation committing to creating a sustainable plan to reduce the number of people with mental illnesses in jails. As of this morning, 434 counties have submitted resolutions to join the Stepping Up initiative. These counties span 43 states and encompass more than 130 million county residents. You can see a full list of counties that have joined the initiative on the Stepping Up website by clicking on what you can do. You can also download a copy of the template resolution on this page. It's not too late to join Stepping Up. Simply download a copy of the template resolution, give it to your board, and submit it to me or Nastasia when you have passed it, and we'll add you to the list of participants and make sure you're connected to all of the resources available through the initiative. Over the past 3 years, NACO and the Stepping Up partners have cultivated a resources toolkit to assist counties in efforts to reduce mental illnesses in jails. On the Stepping Up website, you can access new and archived webinars, download the 6-question Stepping Up framework report and planning tools, review case studies and the latest research, as well as all archived webinars, including the 6-question series. All of the resources are free and available to help you be successful. As counties move forward with efforts over the next year, Stepping Up will focus on providing counties with the tools we need to systematically identify people with mental illnesses who enter local jails. The goal is to have every county collecting accurate, accessible data on mental illness in our jails, and using this data connects people to treatment, quantify the scale of the problem, identify solutions, and track progress on their Stepping Up efforts. More to come on these resources. We have several Stepping Up activities and opportunities coming up in the next few months. In June, Stepping Up will start our 4 Key Measures webinar series. As part of the 6 questions framework, we encourage counties to focus innovations on impacting one or more of what Stepping Up calls the 4 key measures: bookings, length of stay, connections to treatment, and recidivism. Impacting one or more of these measures can help reduce the number of people with mental illnesses in our jails. For the next few months, we will be hosting webinars that outline some key strategies associated with each of these measures and some data collection points for each of these measures. The first webinar will be on June 7th at 2 p.m. Eastern. You can register for that webinar on the Stepping Up Toolkit. And on May 16th, Stepping Up is hosting a National Day of Action. May marks 3 years of Stepping Up and is also Mental Health Month. To commemorate these 2 important milestones, Stepping Up is hosting a National Day of Action on May 16, 2018. During this Day of Action, counties are encouraged to host an event or participate in local activities to share with constituents the progress they have made in addressing the prevalence of people with mental illnesses in their jails, raise public awareness and understanding of this important issue, and emphasize their commitment to creating data-driven, systems-level changes to policy and practice to reduce the number of people with mental illness in their jail. On the Stepping Up Events website, we've posted a Day of Action toolkit that will describe more about what the Day of Action is, why you should host one, and some key strategies for getting the word out locally about your events. In the toolkit, we will talk about some potential activities for your day of action. Every county's day of action will be different, but we wanted to provide some ideas to help you get started. We also have some talking points and a sample proclamation available. If you haven't joined Stepping Up yet or are new to the initiative, this is a great opportunity to do so and kick off your efforts. No matter what you do, we want to hear about it. Post about it on social media using the hashtag you see here. We have some sample posts in the toolkit. Email us the highlights and news articles from your events. On today's webinar, we will discuss strategies for meaningfully including people with mental illnesses and their families in your Stepping Up efforts. Today, you will hear from Laura Usher from the National Alliance on Mental Illness, a Stepping Up partner. You will also hear from our presenters from Tulsa County, Oklahoma, and Jefferson County Metro, also known as Louisville, in Kentucky. I'll introduce the speakers as we go. So let's start with Laura Usher. Laura is the Senior Manager for Criminal Justice and Advocacy at the National Alliance of Mental Illness. In this role, Laura partners with leaders in the criminal justice system to advance NAMI's criminal justice priorities, including reforms to policing and jails. Laura, the floor is yours. Laura, if you've muted yourself, can you unmute your phone or your computer?
Can you hear me now, Natalie?
We've got you. Thank you so much.
Okay, now I have to introduce myself again. Thank you so much for that introduction. It's a pleasure to be here on the webinar with you. As Natalie mentioned, I am Laura Usher. I'm with the National Alliance on Mental Illness. NAMI is the nation's largest grassroots organization of people living with mental illnesses and their family members, and we're a national association with chapters in every state and in most communities around the country. I think I was invited to speak because many of our NAMI chapters are closely linked with their Stepping Up initiatives, and we would like to be even more so. So I'm going to start by walking you all through a document that NAMI helped to develop in partnership with the other Stepping Up partners. It's called 10 Ways to Engage People Affected by Mental Illness in Your Community. And it's some general guidance on how to approach working with peers, family members, and advocates in your community. So I will walk you through some of these suggestions that are very general, and then I'll also highlight some specific resources and information that are specific to NAMI as an organization. So first of all, I would say your first step, if you want to partner with peers and families and advocates, is really to identify the local organizations that are in your community. There are a number of mental health advocacy organizations, and I think what distinguishes mental health advocacy organizations from many other mental health organizations is that we really are made up of and represent people living with mental illnesses and family members. So NAMI is certainly an example of that. Mental Health America is an example of that. And there may be multiple chapters of local organizations in your community. So it's certainly worth taking some time to find out who are the organizations that are already in your community and reaching out to those representatives. Second, sharing information and exchanging information about your Stepping Up initiative with new partners so that they can help spread the word with their members and with the media. One thing that advocates are great at is getting the word out about things that they're excited about and things that they know are going to benefit people who are living with mental illness in the community. And so if there's a positive development coming out of your Stepping Up initiative, we want to know about it, and we want to be able to tell our members about the practical steps that they need to take, whether it's a new resource that's available for mental health services in the community, or whether there's a new way that they should be reaching out when they're in a crisis situation. And these are things we want to know about and tell our members about. At the same time, when there's a really positive development, we also want to be able to share that with the media and help you gain that attention, so that everyone can sort of build that momentum and keep the positive forward momentum going. Third, I would really encourage you to invite peers and family members onto your Stepping Up County team. In all of these efforts, I think it's really important to view peers and family members as a vital partner who can help you make decisions and help you really understand the impact of your decisions on the people who are most affected by them, in a way that other partners in the community may not be able to understand. Our members in our chapters are living and breathing these situations, with members who are encountering police or are being incarcerated, or are family members in those situations. And so we can provide immediate feedback about how these things are playing out, and also provide feedback on policies and positions. So we really want to be at the table and involved in the day-to-day. The next step I would encourage every Stepping Up initiative to take would be to build on existing programs that have already been spearheaded in your community. For example, many NAMI affiliates are involved in starting crisis intervention team programs in their communities, or mental health courts, or similar interventions that are designed to prevent people with mental illness from penetrating further into the justice system. And pardon me. And so it's a great idea to really learn about those initiatives, build on those that positive momentum, and not reinvent the wheel where you don't need to. Next slide, please. I would encourage you to reach out to mental health advocacy organizations and learn about education and training opportunities that they offer. And I'll go a little bit more into what NAMI specifically offers in a minute, but in general, a lot of advocacy organizations offer public awareness training, or training for criminal justice professionals, or education and support for people who live with mental illness or for family members. So there can be a lot available that might be sort of a hidden gold mine in your community that just helps sort of just strengthen your efforts and provide more resources to all of your partners. Next, I would suggest designating a county staff member to be a liaison to peers and family members, just so that there's a clear point of contact in case there are concerns or challenges that come up. And then I have a couple of recommendations for including peers and families in the treatment system. So first, there's been a lot of success engaging peers and family members directly in treatment planning with protocols like psychiatric advance directives and wellness recovery action plans. These are approaches that help people who have a mental illness plan in advance of a crisis situation, sometimes plan in collaboration with their family members and with their treatment providers for what they would like to see for their care when they're in that situation. And this just helps people be more proactive for when they do go into a crisis situation, helps sort of recognize that these illnesses can be cyclical for many people. And so the more that people are engaged in their own care and the more that families are engaged in that process in a productive way, the more likely that you can avoid a crisis escalating to the point where police become involved or the person becomes incarcerated. The next recommendation for the treatment system would be to involve peer specialists to support people in crisis and to help navigate the system. And this occurs in a lot of communities around the country already, in crisis centers, in mental health courts, and in many other settings, where a peer specialist, someone who's been there before, who has that experience of being in crisis or has that experience of having been incarcerated in the past, really can speak directly to a person and give them some reassurance about how the process is going to go, is going to help them do a little bit better and just help them navigate through what generally feels like a really frightening and complicated system. Next slide, please. I'd recommend that you work with advocates and peers and families to understand how the mental health parity law is being implemented in your community and really in your state. And I'll talk a little bit about a resource that NAMI has around this issue in a minute, but just as background, the mental health parity law, it was a piece of legislation passed a few years ago, passed a few years ago, that that required most insurance plans to cover mental health and substance abuse care at the same levels as medical surgical care, which is sort of your traditional medical care, assuming that there was a mental health benefit in an insurance plan. And the idea was that this would level the playing field and that that now people who have a mental illness or have a substance abuse condition would not be second-class citizens when it came to getting mental health care. But several years down the line, the implementation of this bill is still very, very inadequate and varies from state to state. But I think, the important thing to know is that this is an area where awareness of the kind of mental health discrimination that does exist can help informed peers and family members push back on it. And that's something that NAMI has worked on, and there are a number of other advocacy organizations that have worked on that can help equip people to fight for their rights to get their care covered when their insurance company really should be covering it. So it's a little bit of an esoteric policy issue, but it's one that's really important because most people who have insurance, whether it's through private insurers or through public insurers, should have mental health care, but often in practicality, there are a lot of barriers thrown up to that care. And then finally, another way and a fun way to partner with peers and family members in your community is to ask them to help you honor the mental health and criminal justice professionals who are making a difference as part of your Stepping Up initiative. And I think one of the things that we at NAMI love to do is to be cheerleaders and to help when we feel like we've really changed the heart or really sort of brought someone into our fold and that they're really dedicated to helping our community. We want to throw them an awards banquet. We want to have a luncheon for them. We want to give them an award. And so working with your local advocates to sort of be those boosters so that, so that the people in the front lines really know how much they're appreciated and how important this work is, that they are, saving lives and improving lives. It's really important to us that we have the opportunity to do that. So as part of your initiative, I hope that you'll reach out to advocates and explore the best way to do that when there are successes to celebrate. Next slide, please. So those were some general suggestions about working with mental health advocacy organizations that represent peers and families. And I'll just briefly touch on some points about working specifically with NAMI and our local chapter, and just reiterate that NAMI is a national association of people living with mental illness and family members, and we have state organizations in every state. We have hundreds of local chapters around the country, so we probably have a local NAMI in your county or in your city. And we do want you to reach out and connect. This website, nami.org/local, is the way that you can find contact information for your state and local NAMI. Next slide, please. One of the things that our local chapters are really engaged in is advocating for crisis intervention teams in their local communities. And one of the things that at a national level we've really dedicated ourselves to is developing a lot of resources around starting CIT programs, and particularly around creating those partnerships for CIT, sort of sustaining a real community change around that program. So less so around the training and more so around how do you build trust, how do you really get people at the table, how do you create an infrastructure for community and systems change. And I think CIT is a case example for the kind of transformation that I think we're looking for in general with Stepping Up. And so I invite you to take a look at the resources that we have on CIT and think about whether any of them may be useful to you in thinking about the process you're going through with Stepping Up in terms of building those relationships and the ways that peers and family members are included in your Stepping Up initiatives. I was going to try with this slide to show a very brief video that we have on our CIT webpage. So Natalie, if you could give it a shot, I would appreciate it.
Laura, should I click the link or the box?
The box, I think.
Okay, I think we're going to have to skip over the video because nothing is happening when I click on it. But Laura, you've mentioned that the video is available online.
Yes, it is. So sorry about the technological problems, folks. I thought that this would work, but clearly never underestimate the power of computers. But if you go to that link, nami.org/CIT, that's sort of the gateway to all of our CIT resources, and it's also where we highlight this short, about 1 minute video that just sort of explains what CIT is, and it's a real quick way for stakeholders and community members to understand what CIT and why it's sort of a great training, but also a great partnership and a great way for the community to collaborate. Next slide, please. I want to briefly touch on something that was in the 10 recommendations that I covered, and just circle back to how this applies to NAMI. So when you're reaching out to advocacy organizations in your community, I think it's great to find out what kind of education and training and support they offer in the community. And just speaking for NAMI, we offer an array of public awareness presentations, mental health training for criminal justice professionals, and a lot of education and support programs for people living with mental illness and family members. So on the public awareness side, we have a presentation program that is general, that can be offered in a workplace. We have programs that can be offered in high schools. We have programs that really can be offered in any setting, and we're working right now on developing a presentation program for law enforcement training that would be the personal and family story that's specific to law enforcement training. We also provide a lot of education and support programs for people who live with mental illness and for their family members. And I think this is really important for the Stepping Up Initiative folks to know, because in a lot of communities where there are gaps in the mental health system, our programs really provide a lot of illness self-management skills, a lot of coping skills and support for peers and family members who really need that extra support. And it can be a great way when, for example, law enforcement or the courts are interacting with someone and they know that their family needs extra support. They can say, you should go to NAMI and take their family to family class. Or if you know someone is leaving jail, and in addition to all the services that you're connecting them with and all of the resources you're connecting them with, you can say, I know NAMI offers a support group for people who have mental illness. I think you should try to attend this regular support group so that you just have this consistent support group. And all of our services, in general, all of our services for peers and family members are free. So it's one resource that I think you can offer that's available to the whole community. And you can learn more at that link, but also reach out to your local NAMI for more. Next slide. I'm not going to talk much about mental health parity because I told you a little bit about it before, but if you really want to dive into the policy and the discrimination around insurance, you can read our report at nami.org/parity report. It's really quite concerning how much discrimination there is about mental health around insurance and all the small insidious ways that people are denied care that they need. Next slide, please. And finally, I'll just make a pitch for when you take a step back and look at your Stepping Up initiative and what you're trying to accomplish in the long term. Often, I think in many communities, you'll find that you need to build a more robust mental health system that really provides people with care that helps prevent them from ever becoming involved in the criminal justice system in the first place. And I think that NAMI and other mental health advocates can be a really strong ally in helping you to identify what those services are that are sort of missing in your community, and then advocating for them with your state legislators, with your members of Congress, and really just making a lot of noise and pushing a lot of constituent pressure on those leaders, and building a coalition with other community leaders and law enforcement and the mental health system to have a united voice. And just as a sort of demonstration of that, last year, NAMI hosted a Hill Day where we brought advocates from around the country to Washington, D.C. to meet their members of Congress and their senators. And we had more than 1,000 people go to Capitol Hill. And these are just a couple of highlights. One is a member from Montana meeting Senator Tester with her beloved service dog. And then on the right is the NAMI Ohio delegation meeting with legislators from Ohio at a reception that they had planned. So when we have a purpose and when we know that we're all on the same page, we can make a huge difference. And so we invite you to partner with us to try to make that voice heard. So thank you for your time, and I'll cede this back to Natalie.
Thank you, Laura, for sharing that information, especially on the recommendations for how to involve family, people with lived experience, and peers, and then also for just giving us that broad overview of the range of resources that NAMI has available. Now I would like to introduce our presenter from Tulsa County, Oklahoma. We are joined by Melissa Baldwin. Melissa is the Director of Criminal Justice Reform at the Mental Health Association of Oklahoma, a statewide nonprofit advocating on behalf of Oklahomans impacted by mental illness, substance abuse disorders, homelessness, and the criminal justice system. In this role, she engages leaders in redesigning systems to divert those for whom connection to treatment and services is more appropriate. Melissa, the floor is yours.
Thank you so much, Natalie. Yes, I was asked to speak here today a little bit about my role in Tulsa County and also with peers and how that's looked in the kind of the boots on the ground of the planning and engagement process. Next slide, please. So as Natalie mentioned, I work for a statewide nonprofit. We began serving Tulsa in 1955 and in 2014 became statewide. You know, our mission is really to advocate on behalf of those impacted by mental illness. And we trace our roots back to the early part of the 20th century when the father of the mental health movement in America, Clifford Beers, helped to form the National Mental Health Association. We are a Mental Health America affiliate. And the rallying symbol for this mental health movement is the 300-pound bell that was cast from the shackles and chains once used to restrain people with mental illnesses within the walls of psychiatric institutions. And when I first learned the story of the bell, all I could think of is that as an advocate, I can't wait for the day that we can cast from the shackles that bounded people impacted by mental illness who've been over-incarcerated in our country and in our communities for far too long. So next slide, please. Just a little bit about our organization. Our culture is rooted in peers. Each year we partner with the university to conduct staff research via a survey to learn a little bit about our employees. And we've got about 200 employees statewide, and over half of them live in some form of recovery, of about 55% in recovery of mental illness, 36% in recovery of addiction. About 20% of our staff have felony convictions. Almost 30% have experienced homelessness at some point in time. And about 40% kind of a comorbid of one or more of the above. So we really innately see the value of employing peers, and we see work innately as therapeutic in and of itself. We even have an employment first division. Next slide, please. So not just within Tulsa County, but I think within each of our counties, we can see that kind of the fragmented systems of care have made us all struggle to meet the very complex needs of those individuals that we're serving. And as an organization, our mission is really dedicated to trying to reduce those barriers so that individuals can access safe, affordable, and decent housing. We operate a housing first model. We have about 25 apartment complexes and employ the housing first strategies to try and get people connected to the supports and services they need. Partner through the national Built for Zero effort locally with our continuum of care to try and end chronic and veteran homelessness. We've got many programs. I won't go into all of them. One thing just to note, we have had our National Educational Symposium, the Zero Symposium, which is this year, October 4th and 5th. Previously, we've had speakers from Council of State Governments Justice Center about stepping up. Anyone's welcome to come and attend. It's a great conference. We usually serve about 800 to 1,000 individuals at that conference. This year's topic is innovations in mental health. We've got several programs, some of the largest ones in which we employ peers, one of which is our Peer Run Drop-In Center. So this is a place where you don't need an appointment to be seen. You just walk in, and it's for anyone struggling with mental illness, addiction, homelessness, incarceration issues, and all of the staff and volunteers are peers. So what that does is immediately create a welcoming, supportive environment where you can build relationships and rapport easily and help to try and navigate the barriers that this population faces via the use of our peer recovery support specialists. We also have a special partnership with the City of Tulsa. We have a municipal diversion court called the Special Services Docket, and that is also staffed with peer recovery support specialists. And that docket's really designed for individuals with very low-level crimes. I call them acts of living if you're homeless. So jaywalking, public intox, larceny, petty theft, just loitering, everyday acts of living if you're homeless. And what it does is it pairs the individuals with providers like our peer recovery specialists, and they work with the provider. They check back in the court once a month, and at the end of 6 months, the city drops all their fines and fees. And it's a remarkable program to see, and the use of peers in that is just invaluable. It really helps individuals connect and give them the support and motivation and encouragement they need to be successful. As I mentioned, we also have an Employment First, where we build relationships with employers in the community, and we try and get individuals living with mental illness to work who want to work. And we also have various initiatives through homeless outreach and the criminal justice reform efforts that we do, where we're really trying to push the expansion and use of peers. Just as a side note, I want to say, utilization of peers can look like a variety of different options. And I just wanted to kind of give a shout out to our local police department. The Tulsa Police Department, law enforcement deals with mental illness and addiction and suicide and all of the issues as well. But there's even greater stigma within those cultures. And so noticing that they were having an issue with suicide rates, the Tulsa Police Department actually launched a peer-to-peer program to better help with the identification and connection of those who might be struggling, to be able to talk to other law enforcement officers or retired cops or dispatch and help to connect them with internal and external resources to get the supports that they need. So peers can be used in a variety of contexts. So next slide, please. Before I get into the details of my role with Stepping Up, I just want to provide you a slide of a little community context here. So if you haven't noticed from the national news, Oklahoma isn't always okay. We've got some of the highest prevalence rates of mental illness, some of the lowest investment per capita spending. So we really don't invest in this area. And this leads to everyone who needs treatment can't always get it. In our state, with publicly funded services, only about 1 in 3 actually have access to the treatment that they so desperately need. Clearly, we also have very high incarceration rates. No surprise there. So we're number 1 for female incarceration, number 2 for overall incarceration, which I hear we may be also taking the number 1 spot here pretty soon. But incarceration has continued to rise. I will say, however, as a bright spot, today, about an hour from now, our governor will be signing 7 pieces of criminal justice legislation that in total will reduce our prison population growth by about 70%. So this is a monumental step for Oklahoma. It's a good first step, but not the final step, since we're at about 113% capacity in our prison population. Just reducing some of the growth isn't going to be all of the game, but great first step nonetheless. So this is kind of how my role came to be on scene. The stage was set, the need was rampant. It had long plagued our organization, that we weren't doing more about the overrepresentation of people with mental illness in the justice system. So next slide, please. Our CEO is actually a chief empowerment officer. He wrote a small grant to a private foundation to start a part-time position on contract doing this work. Quickly grew to very full-time work. But just a little side story, I found the Stepping Up initiative as a volunteer through my church and knew this was the answer. I happened to reach out to our CEO, and we went to lunch, and I was telling him about this, unbeknownst to me, about the funding and the grant. And by the end of lunch, I was signing papers for a job I wasn't looking for, but it's been such a blessing. And about a month after I began, August of 2015, the sheriff's office in Tulsa was just paramount with being a great partner and helping us to pass our resolution. So my role in our community Stepping Up efforts has really been that of a boundary spanner, and I still kind of remain in that role. First and foremost, I can't underscore how important relationship building has been. Just starting by having coffee and lunch and meeting with your sheriffs and your law enforcement and your judiciary and the different stakeholders, and just listening, active listening skills, right? Hearing what their day-to-day struggles are, what they're struggling with as an agency, how can we be good partners, how can we help? So really taking that approach. Also doing kind of this cross pollination. So one of my favorite things to do is to take law enforcement or a judge on a housing tour within our permanent supportive housing, and they can see people living in recovery, because usually they may only be interacting with these individuals on kind of the worst moment of their worst day. And so it really builds a different level of understanding to get to have that cross-system education. I like to facilitate ride-alongs and jail tours and really getting to view everyone's different lens. I've been kind of the pressure and the glue. So so often we go to meetings and we talk about the problem and we say, ain't it awful? And then we come to the next meeting and might have the same conversation. We've got to have someone whose role and function it is to keep the ball moving forward. So as a boundary spanner in my role, that's been very helpful in the formation of our Stepping Up committee and the various work groups and writing grants and facilitating travel to go learn about new programs and innovations from other communities. So I think that most of my community are grateful that I'm in this role and doing this, because that allows them to keep focusing on what they need to. Also kind of annoying sometimes in the cow prodder or wrangling cats sometimes, but you've got to make it simple for them to be able to plug in, or else nothing happens. I've learned that there's context and there's process. So the evidence-based practices exist, the solutions are there, but really 90% of what stands in the way is ourselves. So how do we, as advocates, be smart in our strategy? How do we navigate all the egos and the power dynamics? Sometimes I refer to my role as tap dancing in a minefield, right? We have to be non-threatening, know when to use karate and when to use judo. Most of the time it's judo. If issues arise, you kind of work with that energy, you redirect it, you come up with different approaches, and then sometimes you have to be more firm and use more of a karate approach. But because of the foundation of relationships that you built, they're able to withstand that. And ultimately, at everything we're doing, we're creating a tipping point in the community so that everyone ultimately is on board with trying to reduce the number of people with mental illness and addiction in jail. Lastly, on this slide, I will say I'm always looking at things from a two-pronged approach, because when I first started doing this work, I would hear all the time, we don't have the financial resources for that. We don't have funds. And we can't let that stop us. So what can we do right now that's low-hanging fruit that maybe doesn't cost anything, that can be creative, embedding social work students somewhere, thinking about solutions outside of the box while we plan for the larger scaling and expansion for the future. Next slide, please. So really, as a boundary spanner, my role has been building consensus, right? Because this is not a red or blue issue. Mental Health Association, our color happens to be purple, so I say we bleed purple because we want better outcomes at a lower cost, and doesn't everyone? So it's about learning the language of each of your stakeholders that you're working with to be able to speak that. We all come from a different agency culture and mission and goal, and so how can I help to pull these ideas and lenses together and move them in a common direction forward? I'm continually trying to examine and keep in the forefront of our values and our culture about recovery is possible and we're stronger together, and a person-first view. One story about kind of abolishing stigma I like to say is that you can really finally start to see some of these cultural changes taking effect. I was at a meeting and someone unfortunately was using the terminology of, oh, the crazies. And I observed a fellow law enforcement officer correct the individual and say, actually, it's person-first language. It's people with mental illness. So that was just one of those moments that made my heart happy. You can really see the culture change starting to penetrate. Next slide, please. So that's kind of an overview of what my role has been in our efforts. Ultimately, I see the Stepping Up initiative as the spark in our community that really created that tipping point of buy-in and agreement to work towards these accomplishments. And it's been really helpful to have that constant advocacy voice to not let the momentum die. We started, in 2.5 years, we've accomplished a lot. We started with a lot of community travel. We went to Bexar County, we went to the National Summit in DC and Colorado Springs, and community travel is just invaluable. It gives you the time and the space to build those relationships and strengthen them. And it also takes a lot of persistence to do this work. One story I like to mention, just to show that kind of out-of-the-box thinking and creativity that it can take sometimes, is when our county had been selected to go to the National Stepping Up Summit in DC, I wrote the application, but my name wasn't important enough to be on there, so I wasn't going to go, but Stepping Up's been my baby. So I called around at Council State Government's Justice Center and finally got a hold of Katie Hebert and explained the story and said, listen, bottom line is I couldn't be on the application, but this is my baby. If I pay my own way, if I don't need a seat, at the end of the day, if I come to a conference and I'm at your door, are you going to tell me, no, I can't enter through that door? And she said, no, I'm not going to tell you you can't come in. I said, great, I'll see you in DC. And so I say this just to show that passion and tenacity that it takes to really fuel these efforts forward every day, to kind of politely push. And we politely pushed on a lot of fronts and had a lot of accomplishments. CIT training is a great example of that. We had various mental health training in our law enforcement community, but it wasn't CIT. They were doing it across the whole state, but not in Tulsa County. And we successfully advocated for that. As a matter of fact, CIT training is happening this week. So after this webinar, I'll go back to that. Sobering Center, we're going to open a Sobering Center for diversion next month. I'm very excited about this, Republican Talks Diversion. A co-responder model that we have a pilot of 2 days a week going. Implementing the brief jail mental health screen at every person at booking. There's really, Stepping Up has just been such a spark and help to us with momentum and many efforts. You can see a few web links to other related efforts that our community has done since we engaged in Stepping Up. We've worked with the Bear Institute for Justice, we did sequential intercept mapping, and our community created a 10-year Tulsa mental health plan with some substantial dedicated resources from private foundations as well. So lastly, on this kind of lessons and persistence, I did just want to say it's not easy because there's going to be things that happen in every community that can kind of detract us. We had officer-involved shootings. We had transitions of sheriffs and mayors, billion-dollar shortfalls at the state level, but we didn't give up. And it's my hope and goal to take this further across the state. Next month in May, Cleveland County in Oklahoma will be passing their resolution as well. I'm excited to see that. Next slide, please. So now I want to look at kind of our community's use of peers in the planning process. Unfortunately, I had hoped to have Kimberly Cummings, our IT director, with me to co-present, but she wasn't available today. If you can switch to the next slide, please. So Kimberly has a very powerful story. For almost 9 years, she's been living in recovery of addiction, mental illness, and homelessness. She had battled addiction for 23 years, overcoming childhood trauma, was facing 10 years for prison for manufacturing meth, but she was diverted into treatment, into a program called Women in Recovery. And from that recovery, in 2009, she got a safe, affordable place to live with Mental Health Association housing. She became an employee. She was an administrative assistant to our CEO, and now she's the director of IT. She's also founded a nonprofit. She's just a remarkable, inspirational individual who's motivated me personally on this journey, and her lived experience has been invaluable in our planning efforts. When we started this journey with Stepping Up, our community already had many pieces, such as alternative courts in place. And I started working hand in hand with Kimberly in her role of her nonprofit to move this community towards a more collective, systemic effort. We had started working with the TJC, Transition from Jail to Community model, bringing stakeholders to the table. And bringing the stakeholders to the table, we had to start with those interpersonal and interagency dynamics because they exist in every community. Sometimes there's city versus county issues or provider versus provider. People would be closed and not willing to be vulnerable and open and show their agency's flaws. There's plenty to serve. And Kimberly always did a great job of helping us keep in mind the impact to those that we're serving and why we're trying to do the work that we're doing. Eventually, it was kind of realized that she was a peer in the process. And it did shift the dynamics a little bit. When we formed our Stepping Up committee initially, we had always had NAMI at the table. They've been a great partner. We had enlisted the support of a peer to be at the table in our committee. And honestly, it was a struggle to keep them engaged. And that's something that I think we all have to take a intentional, constant tending to keep peers engaged sometimes, because sometimes they have other barriers that might prevent their participation easily. But we've got NAMI embedded with our Stepping Up committee and many of the work groups. We had great participation with peers in our sequential intercept mapping. And we've tried very intentionally to make them feel empowered. It's not easy sometimes for a peer being in a room full of, quote, leaders to be able to have their voice, because we don't want peers at the table just as checking a box. We want them involved in the decision making. We want their stories and their perspectives to be valued. And they're also very valuable for helping to share the stories through the media. It really puts a personal face on what we're experiencing. So peers have certainly strengthened our community efforts, made them more rich, centering of why we're doing the hard work that we're doing. But we've also constantly got to tend to that and overcome some of the challenges in engaging peers. So that's everything for my piece. Thank you.
Thank you, Melissa, for the presentation, and especially I think something that hits home with me is you talked about, learning the language of your stakeholders and, in order to build consensus. And I think that's really an important point, especially on the justice side. We tend to use a justice-focused language, and when we're talking about behavioral health, mental illness, substance abuse, it's a different language. And so it's important to learn those language so that you can have a more productive, fruitful conversation. I now want to introduce our final presenter from Louisville, Jefferson County Metro in Kentucky. Kim Brothers is the Vice President of Adult Services at Centerstone, Kentucky. Centerstone is a not-for-profit provider of community-based behavioral health care that works in 5 states. In this role, Kim has implemented programs such as assertive community treatment, 24/7 mobile crisis services, assertive community engagement services, the living room, peer-operated jail diversion, and more. Kim, the floor is yours.
Thank you so much. I appreciate the opportunity to be with you all today. We'll work on how you say Louisville, because as you know, there's a lot of unique spellings or sayings out there for how that's said. Louisville is located, we are the largest city in Kentucky, and we are the 29th most populous city in the United States. You may have heard about a little horse race that we have next week that gets everybody pretty excited. And if you haven't been in Louisville, May is a great time to come and join us. Louisville has a combined area of about 397 square miles and a population of about 765,000 individuals that are residing in it. In 2003, Louisville merged with Jefferson County for a consolidated city-county government that we now reference as Louisville Jefferson County Metro Government. And generally around here, we call it Louisville Metro. Next slide, please. So Louisville has this wonderful history, actually a 50-year history of having a justice commission that was put in place by the mayor. And it is actually the longest continuously operating justice commission. And what that's brought inside the city of Louisville is a huge cooperative, collaborative relationship between community mental health and substance use providers, as well as our chief of police, our director of our detention center, and also in our mayor's office. So the mayor convened the dual diagnosis cross-functional team back in 2003 and charged them with the responsibility of focusing to identify innovative and systemic solutions for coordinating care for individuals with co-occurring mental health and substance use disorders. That was a really big ask for the team to put together, and we really wanted to focus on those individuals who had been identified as what we call familiar faces, or also known as high system users. So these individuals were those persons who rapidly and repeatedly revolved in and out of our local criminal justice system, our treatment, and our service systems. Many of you have probably heard the story of $1 Million Murray, and in Louisville, we knew that we had several of these individuals. We really wanted to create an opportunity to decrease the fragmentation in our service delivery systems so that individuals who were currently falling through our gaps in our services and our lack of communication, and a lot of duplication that was happening around these individuals. And oftentimes we found they had multiple case managers, they were utilizing multiple care providers in multiple systems, and those systems were not in any way communicating effectively around those individuals. And the end product oftentimes was that those individuals ended up incarcerated or in some type of really expensive service delivery model, such as the emergency departments and the hospitals that are around town. So the dual diagnosis cross-functional team is the first metro cross-functional team to involve local government representatives along with participants from the community-based medical, mental health, and substance abuse treatment agencies. So these meetings started out with just really inviting the entire community to come together to start to look at this issue and how we might better work together in a single platform for communication and collaboration in order to help these individuals access care in a meaningful way, in a less expensive way, but to aid them in their journey into recovery. It represented the first time that representatives from all of these different areas in criminal justice came together to share information, discuss our systemic concerns, and work on the common solution of coordinating delivering care to the target population of high system utilizers in the criminal justice system. So this work, I've been actively involved in this work for about 3 years, and at times it really felt like it was breaking down and going very slowly as we would run into barriers in communication, barriers in business agreements, and there would be lulls, but there was always the Justice Commission behind this process saying, nope, we're going to get there, we'll find a platform and be able to move forward. So our dual diagnosis cross-functional team applied for and received a technical assistance grant from the Gaines Center to host sequential intercept mapping in 2014. And we focused on identifying early opportunities for diverting dually diagnosed individuals from the justice system. So while Louisville has an array of programs and services for individuals that are entering the criminal justice system following an arrest, we found that our primary gap was at Intercept Zero that involved the pre-arrest diversion opportunities that would be there for individuals who were experiencing symptoms of mental illness or substance use issues. So in order to address these service gaps, we created a subcommittee of the dual diagnosis cross-functional team called the Public Safety Protocol Task Group. That's big. It's usually just the group. And we charged that group with developing a range of options and alternative resources to be used in the community by first responders on an immediate basis to have opportunities to divert appropriate individuals away from the jail or the emergency rooms. The task group conducted research on evidence-based practices across the nation for law enforcement diversion, including pre-arrest and pre-booking diversion models. And so that's where, next slide, please. This story comes into Centerstone's hands that we, for many years, had been looking, again, field tripping is what we call it in Kentucky, when we visit around all kinds of places. Bexar County was on our list, Miami-Dade, Newark, Delaware, Roseland in Chicago, Meta out in Arizona before they became Recovery Innovations International. We really spent 5 years taking a look at models for pre-arrest diversion for individuals with substance abuse and mental health disorders. And what we came up with is the living room model. And I wish that I could tell you that I invented this, but I did not. It's certainly borrowed, and there are living rooms throughout the United States. We think what made our living room pretty unique is that it is completely consumer operated. So persons with lived experience are on the ground 24 hours a day, 7 days a week, 365 days a year. We began this opportunity just in December 10th of 2017, so we're incredibly new. And the city of Louisville, actually through the mayor's office, agreed to fund us through a demonstration through the police department's budget, which was a pretty fascinating experience for all of us. And we started to work together by forming a steering committee. And our steering committee consisted of leaders within the detention center, leaders within the police force, and leaders in our public health department, and then a variety of leaders in our Centerstone. And so we are a community mental health center, which is in statute in Kentucky. And so we have deliverables to the Department of Behavioral Health. And we sat down and started to really think about what is it that the city needs at Intercept Zero, and how can we help the police? And the assistant colonel of police happened to have been a case manager in our addictions and recovery center many years ago before she decided to be a police officer. And she made this very wise suggestion that the first thing that we needed to do on the mental health side was get into these police cars. And we made an agreement that all of the leaders would spend 32 hours on ride-alongs with a variety of police officers in a variety of divisions. And then from that, we decided it was such a learning experience and such a relational experience that all of the peers and anybody working inside the living room would also, as part of their initial training, be involved in 32 hours of ride-alongs as well. So we have spent a lot of hours in police cars. And at first, I was a little unsure about why we were doing all of this. And then after about the second ride-along, it became very clear of exactly why we were doing this. We were forming those relationships to help our problem solving and decision making to be from both sides of the understanding curve. So we learned from our steering committee many things, that we knew that this had to be 24 hours a day, because a police officer really didn't have time in Louisville to make a decision about what service is open, not open, what's the vacancy level. I think they have the common experience that many local police departments are facing now with recruitment and retention. They're oftentimes down multiple officers each shift in each division. I think in any given moment in Louisville, there's 50 vacancies in police in the streets. And so we knew we had to deliver products that made sense to them, that were super user friendly. So we started to do things like timing a citation. How long does it take to actually write up a citation? And we found that it took 6 minutes on average to create a citation. So we knew we had to beat 6 minutes. So we set a goal for a 4-minute police drop-off time at our living room. And I'm proud to say that this morning we are still averaging 2.5 minutes. We wanted this to be a quick win. We received funding around October, so we wanted to get the doors open so that we would have a decent amount of weeks to show progress before the next budgeting cycle and to demonstrate whether this was meeting the goals of that the mayor and the city council had set up for us. And so we decided to be very conscientious of not doing things much differently than the operations that we have. And our living room happens to be funded. You can see in the bottom picture there on that slide, it's located in a large mental health center that we have in downtown Louisville. So we used space that we already had, and we used a lot of the services that were already sitting inside of this program. So in order to stay within our licensure, guests do stay with us for 23 hours, and that's purposeful language. People coming into the living room are considered guests, not clients. And we really set this up as a high customer service, very comfort-oriented environment to help people feel more welcome and more willing to stay with us. Next slide, please. So the other, some other valuable pieces that we learned inside of our steering committee was the importance of roll call attendance. And we really heard from our partners in law enforcement that roll call, and we also got technical assistance from Recovery Innovations International, who also had the experience of attending roll calls. They did it from a marketing perspective. We did it from a learning perspective initially. And so as we opened our demonstration project, we brought on one division at a time. And we made an effort to attend every roll call in a week for that division that we were bringing on. And we had a typical statement that we made in regards to what the living room was, how you would access it, who we were looking to bring into the living room to offer those services, and what the overall purpose of it was. In the end, I think I personally attended 58 roll calls. We have gotten through all 9 divisions of the police that in Louisville, and we're at the end, we are now in a series of returning to roll calls to continue that relationship building. What we found from the roll call attendance is that we actually began to really know and work with our partners in law enforcement. They knew us, we gave them our phone numbers, they gave us their phone numbers, and we were able to really extend the work of the living room outside the living room itself through those relationships and some proactive co-responding planning around high utilizing individuals, and then just to problem solve as we walk through opening up the demonstration project of the living room. One of the biggest questions that everybody has always said is what we call the officer sort. So in our living room, the steering committee for LMPD certainly gave the officers some direction. They are looking for misdemeanors in general, individuals where there is not a true human victim, nobody has been physically harmed, and one felony of felony drug residue here in Kentucky that is part of the officer's ability to make the decisions in the street. Participation in the living room is completely voluntary. It is a mutual decision between the officer and the consumer, the guest that they are interacting with in the community. We did that again because we didn't want officers to have to call in. We had built a strong enough relationship that we really trusted one another, and we were having really active conversations about individuals that were being brought in. The only rule that Centerstone set in regards to the living room is if an individual is fighting a police officer in the streets, they are probably not appropriate for the living room. One of our biggest challenges is, as much as we knew that the consumer-operated model, the peer support specialists is what they're called here in Kentucky, was the right way to go, we were really not in a place in Kentucky where that workforce had been developed. So we had to make a conscientious decision to develop that workforce. And what we did, the Department of Behavioral Health in Kentucky had a rubric for training peer supports, and we submitted our own training curriculum, and we began monthly training classes for peer support specialists. So inside of our large mental health centers, and we serve about 30,000 individuals annually, we started to really market becoming a peer support as an opportunity for employment. And so if they were consumers of Centerstone Care, then we did not charge any fee whatsoever for them to come to a 40-hour training. There is a test and you do become certified in Kentucky. And we hired a project manager over our peer workforce. And she does the majority of the training with our training institute. And then on about day 3, we drop a recruiter right inside of that training course to really look at engaging those individuals in a process of figuring out what kind of work they would be interested in doing inside our organization or even outside of our organization. Did they want to work with children and families? Did they want to work in addictions? Did they want to work in the living room? And we have been able to recruit so far about 20 individuals to work inside of our living room project. Sustainability is a challenge. It's ongoing. We are currently rewriting our training because we are noticing that we were missing some clinical pieces around their training and wanted to add them in. And then we've started to really take a look at how we work on somewhat of a modified advanced directive for mental health, but it's kind of an advanced directive for employment for our peer workforce. So what are their triggers? What are the action steps around their employment in the event that their symptom set returns or they find themselves challenged by the work that they're doing and having a hard time balancing it? And that seems to be creating some more stickiness for our peers. They are all in general returning to the workforce and have not worked for several years. So we've had to implement some just basic supports around returning into a workforce. Most of them came back in as full-time, and we have had to modify schedules to address that. We did decide to mirror the police department schedules. So a peer works just like a police officer does. They work half of the year, but they work very long shifts, so 12 hours a day. And we have found that when we moved to that model, it seemed to also really help both the relationship with the officers because they were working the same schedules. They started to recognize that and engage with one another. And in addition, we found that they had a lot more satisfaction when you got that 3-day weekend. Our living room, like I said, is co-located in what we call the bigger house of recovery. That living room name has a little bit of purpose. We did some really strategical, you'll see in the right-hand corner of that picture of the living room itself is just a really big basement. And all around the outside of those doors, when you can see a door in the living room, that is a door to another service. So our living room is wrapped with a 24-hour, 7-day-a-week mobile crisis team. That's a team of therapists and a peer and a case manager who will respond to someone who has expressed that they're having a mental health or substance abuse emergency, and they will do a clinical evaluation on that individual. We try not to put that into the living room because we do try to keep the living room a completely peer-oriented environment. And certainly the guests of the living room are very appreciative of us keeping it in that way. And so if they do want to access the crisis team, we'll either move them outside of the living room or into another environment where they feel comfortable. Our homeless outreach team actually sits behind that door that you can see right there. That's a group of case managers who are doing traditional street outreach, but who will also come into that environment if a guest is interested in those services. And we have the adult services engagement team, which is a high utilizer chase team, as we call them. And they are a series of individuals with disclosed life experience, certified peer supports, or community supports who are actively pursuing our high utilizers. Our data today that we got our dashboard in the living room shows us that 33 consumers have used the living room 35% of the check-ins. So we know that the high utilizers are coming into the living room exactly as we had hoped. And so that chase team sitting right there with them certainly allows them to have that connection and that face. And we're watching those relationships get built, and we're watching the services start to creep in. We frequently get asked about our capacity at the living room. We look at that in two ways. We actually look at it as throughput. So our goal for the city was to do 20 guest check-ins in a 24-hour period. We also learned tipping point really fast. How many people could we have in that environment at the same time? And we've learned that our tipping point is somewhere around 6 or 7 guests at a time. In our steering committee, we started to really look at, we can't have a vacancy, no vacancy sign. Police officers can't keep up with that in the moment. And we did not want to create any barriers to use for LMPD. We wanted to certainly be able to divert as many of these individuals as possible out of our overcrowded jail. So we are designed to expand as guest check-ins expand. So if we're getting close to that tipping point, we do have it might be put together with duct tape and pantyhose, but we do have a bit of a plan so that we bring extra peers in or extra service providers in to aid if our guest capacity gets towards that tipping point. In fiscal year 19, we are intending to expand the utility of our living room to become more of an urgent care scenario. We plan on adding 24-hour medical support, nursing support, withdrawal symptom management, as well as becoming more of a urgent care environment for individuals to self-select to come into the living room. At this time, they have to be brought in by an officer or from our emergency psychiatric services located at the University of Louisville Hospital. We actually provide the clinical services in a psych ER. And then we have started to allow some guests to self-select through our crisis and information center if they are directed in from there. But we hope that we will be able to save those police calls, because a lot of our calls that are bringing people into the living room are calls for service on mental health emergencies, and we hope to be able to provide that service without having to engage the police and have those potential encounters. So I do always like to give a nod to Recovery Innovations International, Purcell Dye. If you don't know him and are interested in a living room model, Purcell runs the Newark, Delaware Triage Center, and he has been marvelous in providing 40 additional hours of training for each of our peer supports. So our peers inside the living room go through certification of 40 hours a week, but then they spend an extra 40 hours a week or extra 40 hours in training to work specifically inside this environment. And that training really does focus on crisis de-escalation, engagement, safety, general awareness, referrals, and we have seen that it has proven to be incredibly valuable. Next slide, please. So we do collect a bit of data around our living room, and this dashboard is a little aged now. The University of Louisville's Criminal Justice School has just released last Thursday their first review of our first 14 weeks in existence. And so what you can see here is that we are really measuring and it's simple questions. So if you only have 2.5 minutes at the top of a stairwell to ask an officer 11 questions, you can imagine we're moving swift here. And so we're asking the officer just some basic information. What's your name, officer? What's the call for service number? That's for tracking purposes because the University of Louisville has access to all of the data through the tracking system at LMPD. What led up to your encounter with the guests that you brought in today? We're just wanting to know a little bit about those circumstances. And then the big magic money question is, what would you have done with this individual had you not brought them to the living room? And what you can see here is our slow growth, but we're getting there. Volume is much higher. And we do ask them, the guests at the end, a bit of a survey around how are you departing or checking out from the living room? And you can see that the majority of our guests on the snapshot leave us as crisis diverted. And that's defined as simply as this. They did not go to jail. They did not go to the emergency room, and we did not have to call the police back to engage with these individuals. You'll see the rest generally connected to some other service center or some other form of service provision, sometimes inside our own Centerstone products and sometimes outside of it. So our diversion rate has remained well above 95% throughout the project, and I think we are currently just 5 months in, right on the edge of 5 months in. We weren't fully operational across all of the divisions in Louisville Metro until March, so we really have only had April as a full immersion month where we are fully engaged with all of the divisions of LMPD. And I think that is my final slide, if I'm not confused. I appreciate the opportunity to share our latest innovation with you. Thank you so much.
Thanks, Kim. That was a really great presentation. I had the pleasure of hearing about the living room last week when you were in Alexandria and at SAMHSA's Best Practices Implementation Academy for reducing the number of people with mental illnesses and substance disorders in jail. And it's a great program. We are happy to have learned about it. However, it is 3:15, actually 3:16, and so we've run out of time for questions. I'm sure that there's a lot of interest out there in the living room, in NAMI, in Melissa's presentation talking about the Mental Health Association of Oklahoma. If you have a question, please get in touch with Nastasia, and she will make sure that your question is directed to the presenter or presenters and get a response back to you. I also, before we depart, I want to quickly remind you of the Stepping Up Day of Action that's happening on May 16th. If you want more information on that, please visit the Stepping Up website. Let us know what you're planning to do, and also remember that we'll be launching an evaluation after this call. It should pop up in your screen, and we'll also email it to you in order to get more feedback. We want to make the Stepping Up Network something that is useful for you as we move forward. So really encourage your evaluation and your feedback. As a reminder, our next webinar will be on Thursday, June 7th at 2 p.m. Eastern, and we will share strategies for addressing Key Measure 1, reducing the number of people with mental illnesses booked into jail. You can register for the webinar at www.stepuptogether.org/toolkit. We hope you will be able to join us. Our contact information for the Stepping Up initiative is on the screen. Please don't hesitate to contact either Nastasia, Shanice, or Christopher if you have any questions about the initiative. I'd like to close by saying thank you to all of our fabulous speakers for taking the time to be with us today. Thanks also to all of you for your participation during the webinar. We hope to see you again on future Stepping Up webinars. So again, please be sure to complete the follow-up survey that will appear immediately after the webinar concludes, and we appreciate receiving your feedback. So that brings us to the end. Thank you so much. Have a good day, and goodbye, everyone.